My name is Babita Shashni from University of Tsukuba, Japan. So I'm going to talk about design of short-chain fatty acid-based self-assembling drug for elevation of type 2 diabetes mellitus. Diabetes mellitus is a chronic metabolic disorder characterized by a high level of glucose in the blood. In 2019, 463 people were diagnosed with diabetes, of which about 4.2 million people died globally, implying the need of alternative therapeutic interventions. Out of the type 2 diabetes, which is characterized by insulin insensitivity, is caused by genetic and environmental factors such as lifestyle. There are several reports which have confirmed the association of high intake of insoluble silver fibers reduces the risk of developing type 2 diabetes and insulin resistance, and that is probably because of the bacteria in the gut, which basically ferment the insoluble fibers into several metabolites, including short-chain fatty acids, which have been associated with the decrease in symptoms of type 2 diabetes and insulin resistance. So I will explain about what are short-chain fatty acids in this slide. Short-chain fatty acids are basically 1 to 6 carbon fatty acids such as acetic acid, propionic, and butyric acid. They are produced by the gut microbiota by fermentation of carbohydrates. They are reported to have a lot of beneficial effects on the health. They regulate the immune system. They show anti-diabetic, anti-cancer, anti-liver fibrotic effect, and anti-obesity. And these are the few publications where they have confirmed that short-chain fatty acid has an anti-diabetic effect. Although short-chain fatty acids have a lot of health benefiting effects, but they also have a lot of disadvantages as well because of the chemical characteristics such as low molecular weight, which leads to rapid excretion and low therapeutic index. And if you want to increase the therapeutic index, you inject at a higher dose, which causes severe adverse effect as shown over here. Butyric acid causes severe damage here, and this is propionic acid causing gastrointestinal toxicity. Butyric acid again causing damage to the colon as well. In addition to these, bad palatability and poor odor also causes administration issues in vivo. To overcome the limitations of low molecular weight short-chain fatty acids, we have designed and synthesized a new polymer to deliver short-chain fatty acid. Our polymer consists of hydrophilic PEG, hydrophobic polyvinyl ester, which is conjugated to short-chain fatty acid. In our case, butyric and propionic acid as the therapeutic agent. They are linked to polymer backbone by ester linkage, which is a target for enzyme-based hydrolysis. Our polymer under hydrophilic conditions self-assembles into a nano-sized nanoparticle with hydrophilic PEG in the shell and hydrophobic polyvinyl ester and short-chain fatty acid in the core. So with this design, we can expect much more sustained release of short-chain fatty acid, which prevents non-specific diffusion and decreases the adverse effect. So this is our strategy. So after oral administration of our sample by the mice, it will reach to the intestine where it will interact with large amount of the enzymes and destabilize the nanoparticle, leading to its collapse and release of the short-chain fatty acid by the enzyme-based hydrolysis. The short-chain fatty acid will then enter the systemic circulation and reach to different organs and improves the insulin sensitivity and glucose utilization. So first we conducted the pharmacokinetics of short-chain fatty acid nanoparticle. For that we prepared a polymer which was conjugated with a fluorescent dye tamara to the polymer backbone. We detected the polymer in the intestine by in vivo imaging and Western blotting of polyethylene glycol. Released short-chain fatty acid was detected by ELISA in the blood. Low molecular weight dye rhodamine B, when administered orally, was majorly found in the intestine, but within 30 minutes it entered into the bloodstream as found in liver and kidney. Our nanoparticles, butyric acid nanoparticle and propionic acid nanoparticle, was found in the intestine for at least 2 days and it did not enter the systemic circulation. We confirmed that if this signal is from the polymer, so we detected that using Western blotting, detection of polyethylene glycol. And as you can see here, control has no signal, but both BNP and PNP show the signal at 48 hours, confirming that our nanoparticle was present in the intestine for at least 2 days. Released butyric acid in the blood was detected by ELISA. As you can see here, low molecular weight treated group butyric acid released rapidly in the blood and decreased within 24 hours, whereas our nanoparticle showed much more sustained release until 48 hours. Area under curve of our nanoparticle was also higher compared to the low molecular weight butyric acid group. So this is the treatment regimen. In a diabetic mice, we administer our samples by free drinking for 5 weeks and exenatide, conventional anti-diabetic drug, subcutaneously. At day 37, we conducted glucose tolerance test to check the anti-diabetic effect of these samples. As you can see in this graph, the control diabetic mice showed the highest level of glucose in the blood. BNP and exenatide were the only two groups showed decreased glucose level in the blood. PNP and butyric propionate acid failed to decrease the glucose level in the blood. It means that BNP and exenatide showed anti-diabetic effect. So because we administered the samples for 5 weeks orally, we wanted to see if there was any damage to the intestine by H&E staining. As you can see in the duodenum and colon, control and BNP and PNP treated group shows normal morphology, whereas low molecular weight group, butyric and propionate, the microvilli seem to be shortened. This is the quantitative data. They were significantly lower in case of propionate and butyric acid treated group, which implies that there was some kind of a damage exerted by low molecular weight short-chain fatty acids. So from these data, we confirmed that our butyric acid nanoparticles showed the highest anti-diabetic effect as compared to the other treated groups because of the improved pharmacokinetic properties, and also it did not exert any adverse effect as compared to the low molecular weight treated groups. These data confirm that our nanoparticle is a better choice for treatment of diabetes than low molecular weight short-chain fatty acids.